The Center for the Improvement of Human Functioning International presents this luncheon lecture. Today's topic, The Eyes Have It, Preserving Vision. Your presenter, Rebecca Kirby, MD, MSRD.
Welcome, everybody. Good to see you here. No pun intended, of course. We're going to talk about a topic today that's near and dear to my heart, preserving vision. And the reason it's dear to my heart is because I like to read. And I'd like to be reading until the very end. And you know, by accident, this is National Library Month. So how appropriate can we get? In fact, if you haven't had a chance to visit our library, you might take that opportunity today. Now, what we're going to talk about today is studies that show how you can help prevent three particular vision problems that happen very commonly here in the United States. One is the macular degeneration, one is cataracts, and then we're going to talk a little bit about glaucoma. Then we're going to talk about actually what is involved in vision and how you can help to preserve your ability to see through not straining. And then we're going to talk about all those nutrients that the studies have shown are really helpful for preserving good vision. In addition to taking supplements, we're going to talk about the foods where you can get these very important nutrients. Okay, so what are our risk factors for getting eye diseases? Well, unfortunately, just by virtue of age, that's a big risk factor. And if you have light-colored eyes, that's a risk factor. Being outside without your sunglasses is a risk factor, which has a lot to do with the light-colored eyes, meaning you're getting more oxidative damage from the sun if you're out there without your sunglasses and you have really light-colored eyes. Smoking, even as little as once a week, is a big risk factor. And then we know some diseases, diabetes, heart disease, and obesity are risk factors. Family history. Some of you guys may have family members who have macular degeneration. That's a risk factor. And actually, if they have diabetes, that's a risk factor. And then something called homocysteine. High homocysteine levels are a risk factor, and having too much iron around is a risk factor. And if that wasn't enough, if you're not eating all your fruits and vegetables, that's a risk factor. If your blood sugars are too high, that is a risk factor, as well as, look at this, obesity doubles the risk of macular degeneration and cataracts. Now, obesity also puts folks at risk for diabetes. And if a person is obese, they have tenfold risk of developing diabetes. Well, in diabetes, it's well known there are outcomes that are hard on the eyes, and it's something called diabetic retinopathy, and it's actually developed in 60% of those people who have type 2 diabetes. Now, first of all, let's talk about the macular degeneration. That is the leading cause of blindness in Americans over the age of 40. And it's called age-related macular degeneration because that's the thing they can figure out the best, is that it seems to happen as you get older. So that's what it's called, age-related macular degeneration, and you'll see me abbreviate it AMD because that's the nomenclature there. Affects 1.75 million Americans, and that number is climbing because they think that's going to increase by 50% over the next 20 years. Now, what the heck is the macula? Well, it helps us to see fine detail. And what happens is, in macular degeneration, you have breakdown of that central part of your retina, which is the macula, and what you get is blurry vision right in the middle of your visual field, right in the central part of your focus. And the retina is a little fragile. It just doesn't regenerate when it's had some damage done to it. What it does is it accumulates this stuff called drusen, which is metabolic debris. And if macular degeneration progresses, then people are unable to read. They can't recognize faces, and they're just not able to drive, hopefully, and move around freely. Now, they're still figuring out, all the things that have to do with developing macular degeneration. And since it is age-related, they have come up with the understanding that it's from a lifetime of oxidative stress and damage. Because remember, that retina is very fragile, and it's very susceptible to oxidative stress because it's constantly exposed to light. It needs a lot of oxygen, and the membranes of the retina in the eye are very rich in polyunsaturated fats. And whenever you have unsaturated fats, they can go rancid. And rancidity in fancy biochemical nomenclature is lipid peroxidation. The retina also requires a lot of blood and nutrients. So for all the eye diseases, the best approach is prevention. And nutrition is the key, because remember we were talking about how oxidative stress is part of the problem with developing macular degeneration. Well, we want to prevent that, and one of the class of nutrients that's very important are those antioxidants. And they know that folks who have like a vitamin A and E deficiency increase their risk by 5-fold for macular degeneration. And A and E are potent antioxidants, so is vitamin C. And we know zinc and selenium are very important to the retina as well. Now, there's a landmark study that's called the ARED study, which stands for Age-Related Eye Disease Study. So what they did is they looked at people who already had macular degeneration, and they supplemented them with antioxidant nutrients to see if it would not progress. Now, what happened when folks already had the problems? Okay, so they gave one group zinc with antioxidants, and then one group with antioxidants alone, and then there was the placebo group, and they followed them for 6 years. And they found that if folks were on the zinc group and the zinc and antioxidant group, they decreased their progression to advanced macular degeneration by 30%. Now, those who had less severe disease were benefited the most if they were taking the antioxidants plus the zinc. Okay, so you say, all right, what did they use in this study? Well, the antioxidant vitamin C they used, 500 milligrams. They used vitamin E, 400 international units. Vitamin E is very important for protecting your highly unsaturated fats in your membranes from going rancid. So and vitamin E and vitamin C help protect each other as well. There's another antioxidant that's actually a pigment called beta-carotene, and that was part of their antioxidant package of 15 milligrams. That's a precursor to making vitamin A. It also helps protect against that rancidity or lipid peroxidation. And then they also had zinc in there. And zinc is a cofactor in an enzyme that's very important for breaking down oxidative stress, or what we call radical scavenging enzymes. And then because they had zinc, they added copper, because zinc and copper play well together. All righty. Now, since they had all this data, they kept looking at other dietary factors that might have been important in this study. And one of the things they found that those folks who had the higher intake of the pigments, lutein and zeaxanthin, had lower pathology of their macular degeneration. In other words, the kind of macular degeneration was less severe. And we'll talk more about these pigments because those are really important. And lo and behold, they also found that the higher the fish intake And the higher the amount of those omega-3 fatty acids, the ones we have come to know and love, EPA and DHA, the less severe the macular degeneration. Okay, and then there's something called homocysteine. Now, y'all may have attended lectures where we've talked about homocysteine before. Having levels that are too high is a risk factor for heart disease, dementia, and lo and behold, also macular degeneration. They did a study with women where they had one group on a placebo pill, and the other group got B vitamin supplements that consisted of 2.5 milligrams of folic acid, 50 milligrams of B6, and 1 milligram of B12, which would be 1,000 micrograms. And they followed them and found that those who were taking all the B vitamins, 55 developed macular degeneration, but in the placebo group, 82 developed it. So they consider that a protective factor. And then those who had visually significant macular degeneration developed. In the group taking the B vitamins, it was 26, but it was 44 in the placebo group. So that appeared to be very protective. Now, one of the other things that they've done with data, like in that ARED study, they were actually giving people the supplements, the B5, I mean the ACE, zinc, and beta-carotene. Okay, in this study, they looked at their diets to see if people ate those foods that have the nutrients in them. So this is called the Riordan study, and they looked at folks that were over 55. That's the high-risk group for macular degeneration. And after 8 years, they found about 13.4% of them had macular degeneration. So what they did is they looked at what these folks ate. All right, if you had a diet high in vitamin A and zinc, you had less of a risk of macular degeneration. And if you had even more vitamin C, E, beta-carotene, and zinc, they had a 35% lower risk. So in addition to what they found by supplementing it to help prevent macular degeneration, they find that if you just have a good diet in this, it's a very protective factor. Now that's about nutrients. Let's talk a little bit about sugar, because that's too much of a good thing. It's not good for the retina. The retina requires a lot of blood and nutrients, and it requires a lot of glucose. And it doesn't store a lot of glucose, so it's just depending on the circulation to provide all these things to it. Now, there is a fine balance between adequate glucose and too much. And they find that really when you have those high sustained levels of glucose or glucose spikes, that causes more of those deposits they call drusen in the retina, which is what is the pathology of macular degeneration. So too much blood sugar sustained and too much of it going up and down is not good for the eyes. And one of the ways they came about to understand this is they looked at the women in the nurses' health study who already had some of those drusen and got diagnosed with the macular degeneration. And they looked at what they were eating as far as carbohydrates go. So they looked at like how much was the total carbohydrates in their diet, and then what was the quality of the carbohydrates. And they looked at the glycemic index. And the glycemic index is something that explains when you eat a food how much it's going to make your blood sugar spike. So they found that the higher the glycemic index in these women's diet, they had a twofold higher risk of developing age-related macular degeneration. And it wasn't so much how many carbohydrates they were taking in total, it was the quality of the carbohydrates. And part of Part of the problem with folks having susceptibility to eye diseases with diabetes is, again, that sustained high blood sugar. But one of the important things that they are beginning to understand is you don't have to have diabetic levels of blood sugar floating around and being exposed to your retina to get some of this damage that's associated with macular degeneration. And one of the things that we also understand about those what we call high glycemic index diets is it also promotes inflammation. So several factors there that have to do with how your eyes are affected by blood sugar. Now, there was another landmark study. They abbreviate everything, which is probably a good thing because who wants to say this all the time? It's the lutein antioxidant supplementation trial called LAST study, but you can be sure it was not the last study. And they studied the progression of macular degeneration in folks, and they used lutein to see if they could help prevent progression. Now, lutein is concentrated in the macula of the eye. It's a pigment, it's a yellow pigment, that helps protect the eye against oxidative damage. You know how when you wear glasses that have color in them? Well, that's the same idea. Pigments are preventing the sun to cause oxidative damage to the tissues in the eye. Well, the eye's already got some pretty sophisticated pigments, and one of them is this lutein. So they had one group take 10 milligrams of lutein, another group took the lutein and the antioxidants, and then there was the placebo group. And these are all the things that happened. They got better pigments in the eye, which you'd think so if they were, eating or they were getting lutein. They could also see close up better, and they had better glare recovery when they were on the lutein. And for those who were on the lutein and the antioxidants, their glare recovery was even better. So again, it just sort of reaffirms antioxidants are important, and guess what? So are the pigments. Now, remember what I said about how you have all these polyunsaturated fats and all the membranes associated with the eye? Well, we know about, again, those long-chain polyunsaturated omega-3 fatty acids are very important because there's so many of them in the retina of the eye. So in your eyes, there is a high content of, in particular, of that omega-3 called DHA. We often talk about EPA because it's a big-time anti-inflammatory, and DHA is its pal. They hang around together. But the DHA is particularly important in vision, just as it is in learning, and really important in the development of the retina. So you see DHA supplemented in like infant formulas. Okay, lest they leave any stone unturned, they looked at what's called the nurses and health professionals studies to see if what was going on their diets and their risk of macular degeneration. And the more fat they had in their diets, the increased risk they had of macular degeneration. Now, what was interesting is when they looked at those diets, the higher amount of fat in their diets was associated with a lower amount of zinc, vitamin E, lutein, and another pigment called zeaxanthin. Well, we already know how important these are for the eye, so this was sort of a double whammy. Lots of fat and not enough of the protective antioxidant nutrients. They also found fish eating, but it had to be like 4 times a week, helped to lower the risk of macular degeneration. And that was much more effective than just consuming it about 3 times a month. So we may be handicapped a little bit because we're not very close to the sea, but 4 times a week, that's a lot of fish. All right, now that's age-related macular degeneration. Leading cause of blindness. Well, let's talk about something that's actually more common, but doesn't have the risk factor of blindness because it is treated so readily. But it's so common. Cataracts. 2/3 of Americans over the age of 70 can be affected by cataracts. That's a lot of folks. And what it is hardening of the lens of the eye with poor circulation to that lens. Now, what's interesting about that lens is the fluid around the lens is very rich in vitamin C. And vitamin C, remember, is one of those powerful antioxidants. So we know that risk factors for developing cataracts are oxidative damage from intense sun. You know, going out there without your shades. Poor nutrition. Smoking comes up again. And guess what? So does that sugar. Sugar accumulation in the lens of the eye. This is particularly a problem in diabetes, and obesity is a risk factor for developing cataracts. Now, again, prevention is the best bet. And guess what? It's the same vitamins, C, E, beta-carotene, lutein, and zeaxanthin. And then something we haven't seen before, vitamin B2. That's riboflavin. Glutathione is very important for helping prevent cataracts, because glutathione is another antioxidant that we have in the lens of our eye. And those pigments we talked about lutein, zeaxanthin is another one of them in the eye. They help to absorb the UV light and prevent the UV oxidation. And then there's some amino acids. Taurine and carnitine help prevent cross-linking of the proteins so that you don't get those real stiff lenses, which is the cataract. And they find that when they take out a cataract lens, there's virtually no vitamin C left. So it's the vitamin C necessary to keep the lens healthy is a lot. It's 6 times greater the concentration than what you would have in your plasma. So we talked briefly about B2, another B. They also find that folks who have cataracts seem to have, a lot of them, 1/3, a deficiency in B2, riboflavin. And I don't know if you guys remember back when they used to put milk in clear glass containers, and they sat on the stoop. Okay, well, they quit doing that because the sunlight destroyed the riboflavin sitting in the milk. So now we have, cartons or either opaque milk cartons or opaque glass to protect our B2. Now, in the nurses' study, they found, we've talked about B2, but they also found that those who, again, ate more fish had 12% lower risk of ending up needing cataract surgery. And then there was this new study called the Blue Mountains Eye Study, which is very visually nice, that they found folks who had a better intake in their diet of vitamin C, vitamin C, E, beta-carotene, and zinc had less risk for cataracts. And these are all the things that also help protect you against macular degeneration. Okay. Now, this was an enormous study. They had 36,000 men, and they studied those who developed cataracts and those who didn't. And those who had the highest intake, again, of lutein, zeaxanthin, those were protective in macular degeneration, but they also decreased the risk of developing cataracts. And of the foods that most consistently these people were eating that had the lutein and the zeaxanthin was broccoli and spinach. Broccoli and spinach are actually some of our more common dark green vegetables, so that is probably why those folks were eating large amounts of that and getting their lutein and zeaxanthin. And spinach. What do I always say about dark green leafy vegetables? A dark green leafy vegetable a day keeps the doctor away. I've never been proven wrong yet. Okay. Now, there was a Japanese study that looked at vitamin C, and they said the higher the intake of vitamin C, the less incidence of cataracts in men and women. Now, vitamin C gets even more interesting because I thought I'd show you guys this for those of you who have had your levels of vitamin C, plasma vitamin C, measured here at the center. This was a group of patients who had cataracts versus a group of people who did not have cataracts. Okay, in the cataract group, their plasma vitamin C, which is ascorbic acid, was 0.96 milligrams per deciliter. The group that didn't have cataracts, their vitamin C level was 1.12 milligrams per deciliter. Those are all levels within the so-called average normal range. So you can see why you don't want to be low average. When we calculate the average, if you see your plasma vitamin C level somewhere on the little green average range, that green average on our laboratory values ranges from 0.6 to 2.0. Well, look at this group. They weren't like scurvy, but they were in the lower normal group. So you want to be in that higher group, more vitamin C cruising through your blood to help protect your eyes. Okay, let's talk a little bit about glaucoma. The research on nutrition in glaucoma is not as big a volume as that with macular degeneration, but we do have an understanding of a few things that may help reduce your risk of developing glaucoma. And one of them is the herb ginkgo biloba, that people sometimes take to help with memory. We also know that, again, those omega-3 fatty acids that are those very polyunsaturated anti-inflammatory fatty acids can help prevent glaucoma. And the more of those you have in relationship to the omega-6 fatty acids, which tend to be inflammatory, the better. And so far, nobody's really decided that there's some sort of antioxidant protection to glaucoma, but they're still looking. Now, one thing that does come up is that people with glaucoma seem to have a low level of vitamin B1. That's thiamine. And guess what? They have low thiamine and they have high homocysteine. Here it comes again. Homocysteine in glaucoma. If you have a high level of homocysteine, that has been found in the fluids of people who have, the tear fluids and plasma of people who have what's called primary open-angle glaucoma. It's the most common one. High homocysteine is also associated with people who have dry eye. They didn't find any B vitamin association, but there was another study that did with something that is sort of interesting. They call it ocular Alzheimer's. I'd never heard of this term before, but it sure beats saying this. That's actually PEX glaucoma with abnormal fibrillar material. And I think the reason it gets called ocular Alzheimer's because part of the pathology of Alzheimer's is fibral plaques. So what happens with this kind of glaucoma? Elevated homocysteine again. And they did find that with the elevated homocysteine was the risk factor, and also the risk factor was having not enough of the vitamins B12, B6, and folate. And what's so important about B6, B12, and folate and homocysteine? Those are the vitamins that help you break down homocysteine. So, very important. Okay, now we're going to shift gears from all the nutrients and the ways to prevent the eye diseases, and we're going to talk a little bit about vision. And there is the understanding that the habit of making an effort to see is called eye strain. When you strain your eyes to see far away, your eyeball lengthens. Muscles help your eyeball. It actually just stretches out. That's myopia. If you're trying to see something close up, your eyeball actually fattens up and sort of flattens. That's hypermetropia. Okay, those are all parts of straining to see. It's the muscles changing the shape of the eyeball. Other things that you do when you strain your eyes, you stop blinking and you get sort of fixated. That's what we call staring. Loss of vision with age is not normal aging, but it's acquired from habits of strain. Who said this? Dr. William Bates. He was an ophthalmologist around the early 1900s, and he developed something called the Bates method, where relaxation is the keynote of normalcy. So that good eyesight is the result of a relaxed state of both your eyes and your mind. Eye activity and seeing should be effortless. So his method consists of exercises, techniques to help you restore the natural use of your eye by relearning the art and skill of seeing. Now, has anybody heard of the Bates method before? Dr. Ron raises his hand. I learned about it because my mother tried it back in like the 50s or so. I mean, this has been around a while. The fellow published his first thing in 1920, and then his wife, after his death, republished something called the Bates Method for Better Eyesight Without Glasses. We had that available in our store. But my mother had this little thin blue book, and you would see her doing interesting things with her eyes. And I learned that she had thick glasses. You know, this is back before they had all that fancy eye surgery where people with really thick glasses can like end up with no glasses. And she learned these techniques and helped to improve her eye vision by at least one diopter, and it never went back to the poor vision that she had before. And this method, of course, you kind of have to do self-teaching if you're learning from the book, but in India, actually, they have all sorts of little centers where you go and you get tutored and you learn how to use this technique. And there are some centers around the United States as well. So his philosophy was, why, if glasses are the correct procedure, must the glasses be strengthened because the eyes under their influence have weakened? Well, I thought that was kind of logical. And as we talked about, the focusing of the eye is all the action of these muscles surrounding it. So instruction is aimed at relaxation of the conscious muscles and training of the unconscious muscles to imitate the normal activity of a normal eye. Okay, and here's just some quick tips. You don't rub your eyes. You do not stare. Besides being impolite, it messes with your vision. You do not duck your head and look under your eyebrows to try to see better. You sometimes see people doing that when they're straight on the Okay. Don't hold your breath. Remember, the retina needs all that oxygen for one, but it also helps you with relaxation. Do not force your vision. And when they talk about blinking, you're not supposed to be pounding your eyelids together. You're supposed to be blinking gently. Okay. So how do you properly use your eyes? Okay. You want your eyelids relaxed. Again, when you're blinking gently, and you're keeping your eyelids relaxed. And when you're wanting to look up, don't look up under your eyes. Actually move your chin up so you're looking up like that. Okay, and blinking, you need to do it at least 10 times a minute. and then don't forget to breathe. All right, and when you're reading a book, you keep it at a lower level so your chin's not raised up. You know, you're not supposed to be reading up like this. You're reading more like that. Lower level so that your chin is not elevated. Blink at least twice per line, and do not read in a glare. That causes way too much strain. The idea is we're trying to prevent strain. All righty, now, this is an exercise, and it really does help. Read something in fine print every day. Because if you don't, you just forget how to do it. You practice. And if you can read this, read the small print daily, can be beneficial, but must be done with the relaxed eye. I can see it because I'm real close. Okay, and when you're doing other activities like writing or sewing, keep your eyes moving along your work. This is called shifting. I'll tell you a little bit more about shifting. What it's preventing you from doing is actually staring, which causes eye strain. And you got to remember to blink and breathe. All right. Now, this is one of the easiest things to stop and do to relax your eyes. And since so many of us are doing a lot of intense visual stuff like with computer screens, this is very helpful to stop and let your eyes relax so that you can focus better. And it's just called palming. I'll read you through it and then we're going to try it. You gently place your palms over your closed eyes. You don't mash them. It's just gently over your eyes, no pressure on the eyeball. You want all light blocked out, so you got to squish your fingers together. And you need everything to be black. So you either imagine something black like a black velvet in front of your eyes, or you can actually imagine something pleasant. You need to be relaxed. If you are at a table, you can rest your elbows on a cushion or on the table. And they recommend that you palm for 5 minutes or until the eye is relaxed. Well, we don't exactly have 5 minutes, but and let's try. One of the things I like to do is warm up my hands first, because then you have this nice warm thing over your eye. Okay, and you close your eyes, and then you put your palms over your eyes. All your fingers are together so that you don't have any light, and it should be very, very dark. And you just let your eyes totally relax. They don't have anything to do. And don't forget to breathe. Now, they recommend 5 minutes. Now, in a few seconds, we're going to pull our palms away from our eyes, but as you do, I want you to gently blink. So blink, pull your hands away, and just blink. Now, you might look up at the screen and see if things are a little more focused for you. This is a great technique to practice with an eye chart. You can download an eye chart from like the internet and what you want to do is you want to back up 20 feet from your eye chart and see what your lowest line is that you can read. And you want to practice relaxing your eyes and working on reading without effort, without strain, the next lowest line. One of the other techniques, especially when you're reading those lower lines, is what we call shifting, which is trying to prevent you from staring. When an eye shifts, it sees. You kind of use your eyes as a paintbrush, and this takes a little practice too, because you're sort of letting your vision, bathe over those little bitty letters that you're not able to see on the eye chart. So you travel your eye over the object, and the more you can shift, the better the vision. And they say practice with juggling 2 balls. Because obviously, if you're juggling 2 balls, you're having, your vision, you're not staring, or you'd be, the balls would be all on the floor. And a couple of ways to practice that. There's a couple of shifting techniques. One is what we call swing time. You can do a pencil swing or a bear swing. And what that's going to help you do is improve circulation to your spine and neck and eyes, helps to get that picture all over the retina, to normalize vision. Now the pencil swing is pretty easy. You just hold a pencil about 5 inches in front of your nose, and then you just let your vision travel back and forth and back and forth, because you're not looking at the pencil, you're looking around it. So that's easy to do. And then there's the bear swing. That's why you have a slide of lines, because the bear swing, and it's named after, you know, bears in the zoo, the old zoos where they didn't have anything to do, so they just went like this all day in front of their little cages. Well, get some vertical blinds or something where you have the vertical up and down, and you literally just, you know, you use that shifting motion to keep your eye traveling around all those bars. You're not focusing on anything, you're just letting the eye shift back and forth. And that's part of the relaxation. Bates also talks about how mental vision is, and y'all probably have all experienced this. When something is familiar, like a road sign that's far away, you know it's like the 13th Street exit, you can read it. But if you're in an unfamiliar town, a road sign at that same distance of something you're not sure what it said, you can't see it. So actually, imagination is part of seeing, helping you to remember things in precise detail. And then I just mentioned again, you know, keeping practice with swinging, relaxing, palming, and see how well you can get down to reading the next slowest line. And it does take practice. We had what's called a staff incentive for a month where everybody, I handed out the little test cards. I think that's the next slide. Yeah, and talked about these techniques and had everybody practice it. You'd walk around the center and there'd be these eye charts stuck to the wall everywhere. But with practice, it actually can help you with, you know, palming, relaxing, shifting your eyes over the lower line that you're not used to reading. Eventually, things will come into focus. And then there's the eureka moment when you're reading that next line and you're so excited that you get stressed out and it goes out of focus again. But you knew it was possible. Okay, now, that's the art of seeing, trying to prevent eye strain. Now, let's just review all those healthy things before we conclude that are important to eat to get good eye health and maintain good eye health. First of all, let's talk about some of those B vitamins, the folic acid, B6, and B12 that help lower homocysteine. Think greens when you think folic acid. That's what it was actually named after, foliage. But also beans and greens. You really can't miss out with beans and greens. Brewer's yeast is a good source of a lot of B vitamins. And B6, beans, bananas, potatoes, fish, watermelon. B12 is only found in animal products. So beans and greens don't apply here. It has to be meat, poultry, fish, eggs, or dairy. Zinc actually is in a lot of meats. Oysters are a really good source. But again, you see beans and greens and wheat germ. Selenium, the Brazil nuts take the cake. They have about 500 micrograms per little Brazil nut. Oysters are a good source, and then some of the fish, and again, wheat germ. Wheat germ meaning whole wheat. Can't find wheat germ in white flour. And then omega-3 fatty acids, that's those fatty fish. Salmon, mackerel, herring, sardines, and even rainbow trout has a good amount of EPA and DHA. And we always think, okay, well, what about all that fish eating? Maybe we might be getting something we don't want, like mercury. Well, there is a FDA warning about fish. We're not supposed to be chowing down on shark, swordfish, king mackerel, or tilefish, and I don't think I've ever seen tilefish on any menu, but I'm sure it's common somewhere. These are the ones with the highest levels of mercury. So they do want you to eat fish at least twice a week, but select from those that are lower in mercury. And the most common fish eaten that are low in mercury are shrimp, the canned light tuna, salmon, pollock, and catfish. Now, tuna is very readily available, but the white albacore tuna does have a higher mercury level than just regular old tuna. So they warn, for instance, pregnant women not to eat albacore. Okay, now, back to the B vitamins. Riboflavin is B2, very important in cataracts. Thiamine, B1, very important in glaucoma. Riboflavin, you can eat your liver, dairy, egg yolks, dark green leafy vegetables. Doesn't that just keep coming up over and over again? Thiamine, pork seeds and nuts, legumes, whole grains, and then vitamin C. We always think, it has to be an orange, but it can be cantaloupe, broccoli, green peppers, besides the citrus and strawberries, papaya. There's a lot of things that have a lot of vitamin C. Vitamin E is a fat-soluble vitamin, so you see it in wheat germ, nuts, sardines, but also in those dark green leafy vegetables. And then vitamin A, that's real vitamin A, already vitamin A, is retinol, and that you get from other animals, liver, cod liver oil, and then they fortify it now in in dairy. Okay, but you think, vitamin A, what about beta-carotene? Well, if you eat beta-carotene, you'll make vitamin A. And beta-carotene is a carotenoid, and it's in all those colorful vegetables, things that are orange and yellow. But it's not alone. There's over 800 of these carotenoids, and that includes, besides beta-carotene, the lutein and the zeaxanthin that are so important for the eyes. And we talked about how they're filters against all that oxidative damage, and the macula is loaded up with all that lutein. Dark green leafy vegetables or yellow vegetables is where you get your lutein and your zeaxanthin. And we didn't mention lycopene. However, it's that orange-red pigment that you often hear associated with prostate health. Well, guess what? You may be at higher risk for macular degeneration if you don't get enough lycopene. So again, eating a lot of healthy fruits and vegetables. And one study said a little bit of wine consumption, that red wine with the resveratrol had a protective effect for the eyes. So where do we get all this lutein and zeaxanthin? Dark green leafies, kale, spinach, collard greens, turnip greens, broccoli, peas, persimmons, avocado, corn. Now, lutein is the yellow pigment, but you don't have to eat corn to get it. You get better amounts in the dark green leafies. It's just that the green color masks all that yellow lutein, but it's there. And then zeaxanthin, it's kind of an orangey thing, and you could get it in persimmons, romaine, lettuce, corn, collard greens, turnip greens. There's those greens again. Spinach, kale, orange and tangerine. Beta-carotene, carrots, sweet potatoes, pumpkin, spinach, red leaf lettuce, butternut squash, greens, turnip greens, spinach, beet greens, you name it, mustard greens, cantaloupe, apricots, watermelon, the red bell pepper. And then lycopene is very much associated with tomatoes. Tomato paste, tomato juice, dried tomatoes, raw tomatoes, ketchup, salsa, but you also get some in watermelon and some guava because it's kind of a pinky thing, and pink grapefruit. Okay, now, just a quick mention, remember low glycemic foods is very protective, and most of the low glycemic, meaning it's not going to shoot your blood sugar up, most of the low glycemic foods are your whole fruits and vegetables, except the corn, the potatoes, and the bananas. Those tend to have a higher glycemic effect. Low glycemic foods include all those beans, legumes, and milk and yogurt are unsweetened, are low glycemic foods, or nuts, and very grainy grains. Whole grains, especially some of those that are what we call soluble fiber, like in oats and barley. So the grainier, the better if you're going to do grains. Okay, now if you're interested in the Bates method for your vision, there are a couple of books. This one's out of print, so that would take a bit of a search. That's the one my mom used. But I found this, and we're carrying that upstairs. And there's a couple of websites that are very interesting to study more about the Bates method. And then other things, there's some more lectures up there on the eyes. And I want to thank everybody for coming. And remember, a dark green leafy vegetable a day keeps the eye doctor away. Thank you all for coming today. And we're going to have questions, and they're coming around with the microphones, and then we'll draw for a free lunch and lecture. And here comes yeah, there we go.
I have an unusual thing. I've had cataracts, and I have prism trouble. But the last time I was in, I don't know what it's called now, I forgot. I have like a screen occur in the back of my eye, and it has become ripply in this one eye.
Rippled?
Ripples. In other words, so I see blur. And I can still see out about 50-50 compared with my good eye, but they don't recommend surgery because it's a 50-50 chance.
Oh. Well, I tell you, if I were you, I'd really want to make sure I was getting enough of the pigments like the lutein and the zeaxanthin and all those antioxidants and those omega-3 fatty acids to prevent any more oxidative stress.
You think stress caused most of it then?
Well,
Who knows?
That's what they're blaming for, like the deterioration of the lens and cataracts, and then the insults to the retina and macular degeneration they're calling oxidative stress, because that's what the retina does. It takes in light all day, and the more intense it is, the more exposure it's hard for it. And then if your eye isn't bathed by all those nutrients to help replenish the retina, it just starts to kind of limp along.
I try to eat a pretty good diet. But thank you very much.
Well, you're welcome. And I tell you, personally, with my family history of macular degeneration, I take a multivitamin that's very specific for covering all those things that are important for the eyes, including some of those pigments like the lutein and the zeaxanthin. Just going to hedge my bets.
How about wearing contacts and or using the solution? Does that cause any of the oxidative stress or anything like that, or do you know?
I didn't see any studies about contacts, being a bad thing. Again, a lot of the same things would apply. You just wouldn't really want to expose your eyes to oxidative damage. So even with contacts, you probably want to put on sunglasses to prevent extra light. Because, when I talk about vitamin D and I say get out there, and expose the sunscreen flesh to the high noon sun, do that with your sunglasses on. You don't need to be making vitamin D through your eyes. You need to make it through your arms and your face. Yeah. Anybody? Let's see.
Best choices of sunglasses blocking the blue spectrum.
Well, those ones that say that they protect you against UV. It's all that ultraviolet light. So cheap sunglasses are probably even better than no sunglasses. But there are some that are much more sophisticated, and you don't really have to go high dollar. But they now have those little labels. At least I see about UV protection on these particular glasses. So
I have a dry eye syndrome, and they've called it marginal eye disease. What do you recommend you do for that?
Well, one of the things that we found is that dry eyes respond often really well to the omega-3 fatty acids. That's all that stuff in the salmon and fish oils. And then this study I found was that high homocysteine was associated with dry eyes. So you want to be sure you have enough B12, B6, and folate on board as well. And blink.
Okay.
Gently.
And then I have another question along with that. I have a pug that has dry eye syndrome. The veterinarian gave him drops that increase the amount of tears that he makes. And do they make
They make liquid tears for people.
Right,
Yeah.
but this is a different, I mean, you have to give him the liquid tears, but also it's a prescription drop as well.
Oh, that makes him make tears.
That makes him make tears. And I
Well, I
thought,
hope it's
well,
not
why
good.
don't they let me take that session?
Well, I always find that the veterinary friends are like a step ahead. So maybe in a year or two, we will have those eye drops available.
I could just take Cujo's drops, I'd be okay.
I have 3 questions. First of all, what's the difference between king mackerel and jack mackerel? Is jack mackerel
You
in
know,
the cans?
mackerel, there's a whole bunch of kinds of mackerel, and the king, I think, is the bigger. I'm not being a fisher woman.
Yeah.
I'm not really sure, but there are a lot of kinds of mackerel. And anybody,
What you get in the
Fisherman.
store is called jack mackerel in the cans.
yeah.
Is
now
that okay?
Yeah, evidently, because the king mackerel is a really big fish.
Okay.
Yeah.
And then I missed what you said about milk cartons and riboflavin. What's the
Oh.
deal on that?
Oh, well, the reason they started putting milk in opaque cartons is the milk sitting in a glass bottle on the doorstep was getting sun, and that was destroying all the B2 in the milk.
Okay. And then what's the significance of copper mixed with the zinc in this one study?
Well, if you take in too much copper, you can inhibit your absorption. Well, it works both ways. If you take in too much copper, you inhibit your absorption of zinc. But more to this point, if you take in too much zinc, you can inhibit your absorption of copper. So they were just hedging bets by the fact that they were giving people extra zinc. They gave them a little dash of copper to make sure they didn't interfere with their copper metabolism. Yeah.
I have a question on the red wine.
Uh-huh.
It said a small consumption of red wine. Is there a certain kind, like the Pinot Grigio or something, that has more riboflavins over the others to be a better selection?
It's not the riboflavin, it's the resveratrol, which is some pigment in the red grape. So I don't know if anybody's cataloged how much resveratrol you have according to wine label, but I'm guessing the darker the red, probably the more of it, since it is a pigment.
Okay.
But I'm guessing. One more, 2 more questions.
I read somewhere that if you put vinegar on a baked potato, that inhibits the spike of the blood sugar. Is that true? And if so, is there something you can do to a banana that would inhibit
That's an interesting point, because there are studies that show if you take in apple cider vinegar after a meal, it will blunt that glycemic peak. So if you were eating a high glycemic food like a banana or a baked potato, taking some apple cider vinegar should help it not spike. Now, it also helps if you eat those foods with protein and fat, just because it's much more slowly assimilated by the body. But yes, those studies on apple cider vinegar, and I've looked at quite a few of them, I keep going, who thought of this? It really does seem to work.
Us girls are always wearing mascara and things on our eyes. I was wondering about that.
I haven't seen any studies on makeup being a risk factor for macular degeneration. However, we do know that mascara, if you use it too long, does tend to accumulate bacteria. So they tell you not to be, going down to the last drop, and because every time you pull that wand out, you're, fishing it around in your eyes, you're picking up bacteria, and you just put it back in the little incubator, then you pull it out the next day, and so that's one of the things that's very important, is not to, contaminate your eyes with old makeup.
The preceding program was presented by the Center for the Improvement of Human Functioning International in the Bright Spot for Health Lunch and Lecture Series. To inquire about additional health-related information available on DVD, audio CD, VHS, or audio cassette, simply call 316-682-3100 or drop by 3100 North Hillside in Wichita, Kansas. To discover more about the center and what we have to offer, be sure and visit us on the web at www.brightspot.org.